CAR T cells represent a huge advance in the field of hematological malignancies, but also I think in the near future in solid tumors. And we know today there are 3 indications: lymphomas, non-Hodgkin lymphomas, multiple myeloma, but also acute lymphoblastic leukemia. And when it comes to acute lymphoblastic leukemias, of course, numbers are relatively small because it's a rare disease. But in the last few years, we've seen really tremendous advances, not only with CAR T cells, but also with other immune therapies like the bispecific BiTE blinatumomab, which is approved for relapse refractory ALL, but can also be used in case of MRD positivity. And achieving MRD negativity in this disease is very important for the long-term outcome. We have also the antibody-drug conjugate inotuzumab, which is also a very huge advance. When it comes to CAR T cells, the story started with the children, the adolescent, but now the experience is accumulated in the adult population. And this used to be a true unmet need. And today, we are able to deliver these CAR T cells, and we're talking about the autologous anti-CD19 CAR T cells, but in the future, we'll probably have dual CAR T cells, we'll have fast CAR T cells, many, I would say, fancy new constructs to avoid resistance. But at the end of the day, it looks like, and now we have, I think, a decent follow-up, it looks like that there is a plateau when it comes to using these CAR T cells in adult ALL, and maybe roughly 30% of these patients are going, 40% are going to enjoy long-term leukemia-free survival. Of course, the big question we have today is whether we need allogeneic stem cell transplantation as consolidation after CAR T cells. It's a big question mark. If patients achieve MRD negativity after CAR T cells, one may speculate that you don't need it, but of course, we are still lacking data in favor of this approach versus another approach. But at the end of the day, I think the outcome of adult ALL is really improving, and it will continue to improve, and I think we will cure more and more adult ALL patients.